And now back to this. Dr. Tlaleng Mofokeng, affectionately known as Dr. T, author, medical doctor, and reproductive and sexual health rights specialist, was appointed as the UN Special Rapporteur on the right to health, becoming the first woman and first African to hold this role. Dr. Tlaleng's advocacy and work for reproductive and sexual health rights have spanned many years. This past week, she was listed in BBC's 2021 100 Inspirational and Exceptional Women Around the World. Next year, Dr. Tlaleng will deliver her thematic report at the 50th Human Rights Council session, where it will focus on violence and its impact on the right to health, and has thus called for public submissions on key issues around the report theme. She joins us now to tell us more about this recognition and her report that she will present next year. Dr. T, good morning. Great to speak to you. Another accolade, feather in your cap. How do you feel?
Thank you so much. I mean, I think, we don't go into this work looking for accolades, but every now and then, they do come and they affirm the work that we do in a very important way. And I think, many people are not aware of how well funded and organized the anti-gender, anti-rights, anti-sexual and reproductive health rights movements have grown globally, even on the African continent. So to be doing this work at this level, at this pace, in that particular difficult context, I think it's a very welcome accolade, and one for me personally that says keep going. The work is impactful, and I think that's the best thing that one can hope, right, is that your expertise can literally have tangible benefits for people across the world.
Now, obviously, the world is listening, hence the accolade. How much of a burden or weight does this put on your shoulders? I mean, there are millions of women across the globe, never mind South Africa, that are expectant, that are crying because their rights are violated.
Every time I speak, I remind people that I am from Kwakwa, and it's important because that particular place in South Africa locates me within a particular context and time. Having been a child who grew up in apartheid and an adult who's navigating a democratic South Africa, it's important to realize that these accolades, as they come today, there's a history to them. And for many of us, there's a lot of injustice that happened in how we are able to even get to medical school, to even get to the spaces such as the United Nations and be a Black woman and report to the General Assembly and the Human Rights Council and do this particular work. And as much as I always say to everybody, I'm not doing this to save other people, but the fact that there are women like me, who look like me, who sound like me, who have the same socio-political context and history as me, who find resonance, who find meaning in my work. I think that's what's important for me. And I think we all have to do what we can from where we're at. And that's what I can say to women and adolescents and young girls anyway, who may be disempowered by either the legislative framework they live in a particular country, or by some socio-economic, political, context, to say that you may currently not be able to speak enough or loudly because it's unsafe for you to do, but I will. Because at this particular point, with this mandate of the UN and the work that I do as a medical practitioner, it's very, very important to speak truth to power, which is why my focus has always been clearly on decolonization in global health, on democratization in global health, but also the restoration of dignity. Because for many women and girls, it really boils down to our dignity, where on a daily basis, whether it's violence, whether it's unfair, workplace environments, whether it's unhealthy, environments where we live in, our dignity is constantly being stripped away. And my little bit is to try in everything that I do to restore that dignity and to lead everyone to substantive equality.
Well, Dr. T, next year is the 50th Human Rights Council session, where your themed report will be heard, your voice will be amplified. What is that message that you're going to be speaking?
So the important thing is that I, of course, because of the mandate of the right to health, have to report to the Human Rights Council and General Assembly every year on the emerging trends around the right to health, but also report and respond immediately to any human rights abuses or violations related to the right to health. So it was important for me to have a call for contributions, because I do this work and I have a particular viewpoint, but there are many, many other realities that many people are living under in the world. You know, people are living under the constant threat of war. Some are experiencing war and how that impacts on their right to health. Some people, for example, in South Africa are still struggling with affirming transgender health. And we need to start looking at institutional and structural violence as well as important, you know, when you think about the lack of comprehensive survivor support, you know, post-violence. Those are very important, but I don't want just my voice to come through. I need people from all over the world to contribute to that report in the many ways that they can, whether it's on a policy issue, legislative issue, a service delivery issue, or it's the issue of society and changing the context and the kind of fabric, right, that we are all having to navigate in society. So it's important for me to bring that voice through to the United Nations. It's not often that people like myself are independent experts at the UN. And so what I plan to do with this role is to be intentional about bringing those voices, making sure and demanding that they are heard, because people have always been speaking. It's that there are particular ways and that the world and society is structured and the hierarchy that makes others not heard and not seen. And with this report, I'm trying to elevate the voice, amplify the work of communities, and bring it to the UN and also expand and recommend on best practice. What is working, so that member states can understand, if we do more of this, we will get these particular health outcomes. And so it's not just a report of diagnosing what's wrong, but I'm also very intentional about reporting on what actually works.
Now, Dr. T, a voice that's been knocking on your door is that of the Global Nurses Union, and they sent a letter of complaint to you. They represent over 2.5 million health workers concerning trips and the unfairness around that. Walk us through that, the contents of that letter and your plan of action.
So the nurses petition actually is part of the bigger spectrum of work, and healthcare providers across the world have been dealing with, of course, COVID in a clinical setting, but there's also the political issues around COVID, where many were forced to go into health facilities and respond as first-line responders without adequate protective equipment. Many salaries have not increased. In some instances, they've been cut, and they're not, you know, specific to just the Nursing Council, but that petition is very clear in terms of what the complaints are around abuses and future human rights abuses. I've also been, as a mandate holder in the past 2 years, involved in various interventions at the UN. Some letters remain confidential between myself and member states. Some letters become public after 2 months, where there have been allegations of human rights abuses, particularly through healthcare providers. And there's a case in India, by the way, where I responded and intervened, where healthcare providers were being physically and verbally abused in those COVID wards, just simply because of the pressure from the community. So it's very important to understand that healthcare workers are an integral element to the right to health. They are the ones who are able to translate policy into action, but also give quality services. And so if healthcare providers themselves, their own physical, mental, and labor protections are failing, it means they cannot deliver to the rest of us, who are the citizens, quality, accessible, and acceptable healthcare services. So it is a big focus of mine. Even in the upcoming report, I will be dedicating a portion of that to the types of challenges and violence that healthcare providers are experiencing in the workplace, firstly from their employer, which is the state, but also from patients and their families as well.
Finally, Dr. T, just walk us through how people can contribute to this report.
So the report is available. The website that I have from the United Nations, it's ohchr.org. And if you put Tlaleng Mofokeng, it will lead you to my page. And over there, you can navigate and get previous reports, but also get the call out for contribution. And if anyone can't do that, please tweet me at Dr. Tlaleng on Twitter. You can also tweet the UN itself at UN or the Human Rights Council as well on Twitter for this report. But what I will do after this is also just attach it to some of your tweets and just get the reach, going and reaching as many people as we can. But it's ohchr.org. It's the Office of the High Commissioner for Human Rights.
Dr. T, it's been an absolute pleasure. Thank you for your time this morning.